Well, welcome back to Managed Care, and now let's go over and see how well you did on the questions here. Now, the first one says, specialists can choose to be the gatekeeper for their patients. On your test, that is a true statement because your OBGYN can be your gatekeeper, which is your primary care physician. Now, number 2, gatekeepers are a common feature of HMO plans. That is true. And for your test, we need to associate primary care / gatekeepers with HMOs, not with PPOs or any other program, even though we know you can have a gatekeeper in some PPO plans. Don't go there. You're being too smart. Now, 3, referrals to a specialist must be authorized by the gatekeeper. Just written that way, it would be true. However, sometimes on the test, they'll have a question and they'll say which of the following is false. And all the statements are true. It is usually this one that will be false because they'll put another absolute term in there. All referrals to specialists must be authorized by the gatekeeper. Well, there's always exceptions to everything. However, that's usually only the case when you find all the questions are correct. Now, 4, primary care physicians acting as gatekeeper are a common feature of a PPO. This is where you're going to answer false because you should have been an HMO, not a PPO. Now, let me move this up on the screen because I'm reading it across the room so that I can face you. In fact, I'm looking straight at a camera, and I swear the next time we're doing it, we're going to put a face on the camera and a pair of eyeglasses. Now, 10, wellness benefits under HMO would cover fluoride treatments. The answer is false. Now, 11, only HMOs pay their providers based on a fixed or flat fee known as capitation. Well, that is a true answer. Now, always associate capitations with HMOs and nothing else. Then, 12, I'm sorry, I could barely read it. Then PPOs normally pay their physicians directly, and the answer is fee for service. So for test purposes, I want you to think of HMOs, fixed flat capitation. In other words, they might be getting $10 for each subscriber, and that medical group's in charge of 1,000 people. So once a month they get a check for $10,000, and they have to divide it up amongst themselves, and it doesn't matter if they don't see a patient or they see a patient more than once. Now, everything else is going to be commission work, even the other managed care plans. So commission work is fee for service. Just realize that PPO, it's a discounted fee that they have agreed to be published in all those books. It's a great way for a brand new doctor to build up clientele, but it's still fee for service. So in our industry, that would be a commission. Then 13, a physician in an HMO plan that makes all referrals to a specialist is known as the gatekeeper, all right? Then 14, the core benefits of an HMO include inpatient, outpatient, emergency, preventative, out of area, and prescription drugs. That's only false because of prescription drugs. Remember, that is always an option or supplemental that is added to the plan. Now, 15, HMOs are both healthcare financing and service mechanisms. The answer is true. And 16, HMO members are required to pay a small deductibles for basic services and larger ones for services like alcohol and drug rehabilitation. That's false because HMOs in the beginning, because everybody's gotten all kinds of hybrids, was no deductibles. You would use the word co-pays, but not deductibles with HMOs. Now, 17, HMOs offer both healthcare coverages and healthcare services. True. And then 18, capitation is a term only associated with HMOs. True. I'm just re-emphasizing a point. Then 19, capitation is a fee for service that's been discounted. False. Remember, it's a fixed or flat fee. All right. Then 20, an employer who settles their own health or disability claims is a third-party administrator. False. That third-party administrator is an independent outside source that is handling the paperwork between an insurance company and the employer. Now 21, under the PPO plan, you may select a doctor or you can see a non-preferred provider without a reduction in benefits. The answer is false because of the word without. You can see a doctor that is not on the list. However, there will be a reduction in benefits. Then 22, in a PPO, you can only see the providers approved by the plan. That's another way of saying what we just went over, and the answer is false. You can go off the plan. Now, if it's an EPO instead of a PPO, then you cannot see providers not on the plan. They would not pay if you did. Then 23, HMOs emphasize preventative medicine and early treatment with prepaid routine physicals or medical exams. And then HMOs and PPOs are deemed to be managed care. That's true. Remember, managed care is any time we are going to control the behavior of the participant. So we do that by restricting who they can see and getting approval before procedures are done. Then what's going to happen here is then 25 is going to be HMO members may be required to pay a small copay. And then 26, HMOs are established as both open panel or closed panel. Open means they see private patients as well as HMO. Closed panel would be that they see only the HMO patients. Example, closed panel would be Kaiser. All right, we are now done with that section.